We are back. We're going live to talk about skin surgery. So we'll wait for a few folks to join us. But I do have some pictures to share, and these are questions that came through. So good. Stop sharing. There we go. Wait for a few of you to join. But hello, I'm doing a skin surgery Q&A. I recently just had about 10 days ago loose skin surgery. I had an incision from the hip to the hip and up the middle, and they ended up removing 12 pounds of skin total. The 12 pounds of skin, hey Kels, the 12 pounds of skin was, I think, 5 kilos. 5 kilos, which she says was 12 pounds, and that was just in my midsection. I have not yet gotten done my chest area. The chest area that she wants to do is essentially removing the nipple and the extra skin around my chest, and then taking care of under the armpit to kind of make sure that that all gets tight like my midsection. So I did have some... This is going to be available to watch later. I'm going to save this on my profile, and then I'll also be downloading it so I can post it on YouTube as well. That way, if at any point you need to go back and see kind of the in-depth answers that I can try to answer in regards to skin surgery, I will do that. So what I'm going to do is actually show you some of the questions that came through, and I'll just start answering them, and I'll try to be conscious of the questions that come through here in the comments. If you do ask something and I miss it, I apologize. I'd be happy to answer it in the DMs, but I'll do what I can to try to answer as many questions as I can. So the first one here is there we go. And can somebody give me a thumbs up if you can see the questions and if they've come through. Let me know if you can see it. A thumbs up. Oh, that's zooming me. Thumbs up. Awesome. Okay. So I want to do this surgery. It's the first one here. I want to do the surgery, but I live alone. Would you hire a nurse for 4 to 8 hours a day be enough? I was talking this over with my wife because I needed assistance with everything. So assistance from going to the bathroom to getting up, to getting water, to getting food prepared. If you can have someone that can more or less check in on you throughout the day, that would be better than a long stretch person for 4 to 8 hours. The 4 to 8 hours leaves a gap of time to where nobody will be there. And if you get up and all the blood rushes and all of a sudden you black out for a little bit, a lot of folks have blacked out the first time they've sat down, the first time they've gone to the restroom, they've blacked out. And to be in that position where no one else is around, that's where it's a little bit more of a worry or a concern. So instead of a long stretch, if someone's available to check in, maybe in possibly setting up a schedule like, hey, do you mind checking on me every day at 10 and 2, and somebody else maybe 11 and 3, getting maybe a couple folks involved, or having somebody check in on you every 2 to 3 hours. It's really going to be about planning before the surgery, what you're going to do when you have to go to the restroom, how you're going to get water, how you're going to get nutrition, how you're going to go to the restroom, who's going to provide cleaning, and what are you going to have accessible near you just in case you need something. Sitting down and resting is going to be really important during the whole thing. Well, what's going to be nearby that's going to be able to be accessible when no one's around? So that's really, really important. I will move over to the next question here. Did you do this out of state? If so, why? I did not. I actually did it here, home state. I did it through Vanderbilt University. They have a plastic surgery department. I have, and this is something I would recommend, is you get at least 3 consultations on what they think you should do. I got a recommendation, do a 360, a Fleur appendectomy a la Fleur, which is hip to hip up the middle. And then I had someone that just wanted to do hip to hip. I ended up going through the hip to hip up the middle because the doctor that I worked with and working with, she did a fellowship or an internship with an aesthetics, essentially working on what the long-term look of it would be. And she noticed that the 360 could be a possibility, but that I could probably do a hip to hip up the middle and be okay, because most of my weight was carried in my front pouch area. And so that was the main area of concern. Less on back, but more or less in that front pouch area. A lot of folks can just get a 360, push it down, have it stitched, and be fine. And the aesthetics is great. I carried a lot of my weight in that front pouch area. And so that's where the concern was, is that that front pouch or pooch area. If I'm able to do a picture, yeah, there we go. So you can see here, this was where the front pouch area. See, because I had a lot of extra skin in that middle portion area, that's mainly where she wanted to focus her efforts. Yes, she could have done a 360 along the bottom to tighten everything, but right there in the middle, that isn't going away with it coming in close. If they're doing a 360 and bringing it down, it doesn't do anything with that middle portion. And then she was marking where my chest was, because since I still have my chest now, she has to mark where, okay, this is what it's going to look like afterwards. What about the mons pubis just below the stomach? Is that combined in the same surgery? Yes, so that is essentially the hip to hip up the middle. That's what she's marking. So you can see here, and I can't share underneath this gown area, but she's marking where this line is across, or where the top of this picture is. There's also a line right here. She actually lifts up the stomach and she brings a line, and she essentially shows herself in the operating table where the line is going to be on top and where the line is going to be and where it's going to come in. See those two lines that are going up like a Christmas tree? That's where she brought it in. Now she can make adjustments on the operating table to bring it a little bit tighter. And I think she did, because she said it was pretty tight when she ended up bringing it in. But those lines are kind of giving her, okay, where's the center of your body? One thing I didn't realize that they do is she actually had me push out my stomach as much as I could, and she started to feel my abdominal walls and my interior abdominal muscles. So that way where the lines are will kind of fit where the aesthetic of my lines and where my skin will end up settling. So the line that you see right here, that line matched right where the pubis area is. So that way it actually is completely stitched together. So now it's a complete flat line all the way through, in which you might be able to tell a good picture of that, which you could probably see down here. So hopefully now that this is, I've shared this area, look down here in this corner. See how that bottom area there is now attached to that bottom darker area? That darker area is that pubis area. And then you've got right above it, which is the stomach. And then you see right in the middle is where she got a lot of the excess and brought it in. And so that's where I benefited from not worrying about a lot of this extra skin that you see around me, because she ended up cutting along this line here, going below, making a drawing before surgery of where it would be coming up, and it was essentially brought together and stitched and glued. And so that's where I'm currently at. I'm stitched and glued with what you see here. And so that's what that's essentially what the procedure that she did, hip to hip up the middle, for something like that. Now, timeline for your workouts to resume. 6 weeks is before I can lift anything. I shouldn't be lifting anything for 6 weeks. That's the first go-to. Don't lift anything for 6 weeks. But the important part is at 6 weeks, I'm going to have to start slow, and I can't just go into the workouts that I was doing before. I'm not going into deadlifting. I'm not going into squatting. I've heard with the amount of skin that I had removed, 12 pounds, and the amount of rerouting and replacing things here, it's probably going to be about 3 months until I can fully get into how I was doing things before. So June 17th was my surgery. I'm looking at September 17th before I can really say, okay, I'm ready for full-blown workouts. I'm not going to actually see the full results for a year. So I can't expect to see everything done and the full results to be done in, say, the 3 months when I can start working out. But I'll probably be able to get back to my running, my lifting, my preparing for races or triathlons, all that good stuff, probably for 3 months. And I'm really glad that someone said 3 months will fly, because I welcome that. And patience is important. I think the thing that you're going to encounter if you're thinking about this surgery is you're going to get to a point, and I've heard this is about week 4. About week 4, you feel good. You're recovered. You're in a better place, but you can't lift because you still have some internal healing. You've got some things that still need to go on, but you feel antsy, like you just want to get back to it. So that's one thing that I've heard. Even if they clearly listen to how you feel and be cautious with what you need. Wonderful, wonderful tip. You've got to listen to your body, because I had someone, the doctor told me it was 3 weeks. They didn't have the bandage off. It was a lot smaller of a tummy tuck. And at 3 weeks, she reached for a ceiling fan and the wound opened, or the incision opened. I was like, I'm not reaching for nothing for quite a long time. So be mindful, be careful, listen to your body. That's really, really important. Is liposuction for those tiny bits in that you can't get with diet and exercise used too? So I did have liposuction with mine. There were some areas that with diet and exercise can go away. So you can minimize your body fat, and a lot of the excessive weight that I had on the side, that is something that can be done and can tighten up. I've had that tightened up before. I got what you got. I got what you call, after my second child, the dad bod. After baby number 2 and the scares that we had with baby number 2, it was a lot easier on the way to the hospital and the way back, and the multiple trips we had to make to the fetal medicine place and all the complications, to just grab something easy and grab something on the go. And that was a very stressful time, very, very stressful time, holding a lot of water weight, especially with all the additional cortisol. So there was definitely some excess, but liposuction is something that can get rid of those items. And oftentimes during skin surgery, they will include liposuction, because the doctor's really looking for a good aesthetic and not just to check a box that they got rid of some of your skin. They're wanting it to look good. And so oftentimes liposuction with a skin removal does happen hand in hand. So the question down here, worth it? I'm only 10 days out from the surgery, so I haven't seen all the benefits of it. I haven't been able to wear a complete outfit yet, because I still have a drain. I still have my drain on my right side, and it has about 15 cc's in it. So you can see here, there's my drain. It's got about 15 cc's in it every day. And so it's cleared to come out next Monday, but I usually wear comfortable shorts and a comfortable shirt over my binding, and that's it. So I don't know really what it's like for it to be flat. I haven't felt it. It's still very numb. It's still very sensitive. I don't know what it's like to run without the skin bouncing, because I can't run yet, or jump rope. So I feel like I am going to say it's worth it. But just to be honest with you, I'm not there yet to say all that this pain is worth it being gone. I'm just still in the thick of it for me to even say that. I'm sorry if I already covered it, but they operate on your chest to fix any loose skin there? So she said because she was going so high, she was going to try to get some liposuction in the chest area. But when you look at my photos, it looks flat. Well, if I stand straight up, I've got a good, this is all skin from the chest itself. This isn't actually the muscle, but this is all skin. So she really didn't do much with the chest area. The chest has to be a complete separate procedure, and she really didn't do anything there. She tried to get some, but I noticed once, I think it was day 3, when I stood up a little bit and looked, I was like, okay, I can see where she put her focus and where I still have some work to go. So let me see if I can see this question here. Sorry, should have signed. Do you think the skin removal is worth? Okay, so answered that one. What is the best way to track your food and calories in a food tracker? So I think I can answer this real quick. I know this isn't skin surgery related, but I think the Jenny Rose, what's some advice to keep with your fitness journey and stop quitting or failure on getting off the wagon? So as far as a food tracker, MyFitnessPal is the go-to. A lot of folks talk about Noom. What's biggest thing for me is what is not a huge abrupt change. When you go through abrupt change, you can stick with it for a little bit, but ultimately you're going to want to get back to what you're comfortable with. That's why a diet will last for 5-6 weeks, maybe a couple months, and then you'll fizzle and you'll get back to what you were doing before because you're just used to what you were doing before. You've got to gradually insert habits into your daily life that become normal. Before I had skin surgery, when I was working out and what I'm eating, that's normal for me. So it's not different for me to eat a high protein meal or know what a high protein snack is, or for me to work out, or for me to do certain workouts or to lift. It's just normal. So the journey of not quitting is starting small enough and getting into a habit of something that you're not going to end up just throwing in the towel when it gets rough. You've got to get into something that you're really comfortable starting. And that's the frustrating part. Well, if I start small, if I start slow, I'm not going to lose all the weight quick. That's the key to it all. You've got to give it time, at least 2.5 years to go through your complete. It doesn't matter if you have 20 pounds to lose or 300 pounds. You've got to give it at least 2.5 years. And if you prepare yourself mentally that it's going to take that long, you're going to set yourself up by saying, you know what, I'm going to focus this first month on just getting into a habit of tracking my food. And that's all I'm going to do. And I may be over in calories one day, I may be under, but I'm at least going to build a habit of tracking. And then you just build. A lot of successful people on this weight loss journey are just habit builders. They build new habits to overwhelm or to offset or to override a prior habit that put the weight on. You've got to essentially build a new habit that helps keep the weight off. Some other questions that came in here. Let's see. Are you still taking good care of FundMe donations? I was asking my wife about this. I think what this is asking is, am I still taking GoFundMe donations? So the GoFundMe that I had originally essentially was for my abdominal and my chest area. Based on what I raised, which I think was $89.30 out of the $16,000 that I was asking, $89.30 was raised. That allowed my abdominal area to get taken care of, but not my chest, unfortunately. So I ended up moving the campaign away from the GoFundMe on that particular campaign. I ended it at the $89.30 that was raised, and I created a new GoFundMe, and it's just for what's left. It's just for the chest area. And so any donations to the GoFundMe that I have up currently is essentially just to finish my loose skin. The doctor, because it's more cosmetic, won't book my chest surgery until I have the funds. So essentially, I would just be waiting out until I'm able to raise the funds to book the ability to finally complete my chest or complete my loose skin. My doctor mentioned that it would have to be at least 8 weeks from the first surgery for them to do the second. So if you're thinking about 2 surgeries or a couple, just know it's going to be about 2 to 3 months in between surgeries, that they're not just going to be able to do it 2 weeks after your first. You're going to have to wait after the first one more than likely. How bad is it having drains to deal with, and how intimidating is the wound care? Okay, this is a great question. So the drains coming out is worse than anything that the drains have to do with any kind of maintenance or care. You don't really have to worry about the care. So essentially what I was given was a piece of paper for both the left and the right side in a container. And twice a day I would fill whatever got into this container. So anything that got into this container, I won't show the liquid that's in it in case you're queasy, but any liquid that's contained in here, essentially I would pour in the bottle and I would make a log of it. The very first day from the hospital, both bottles ended up 210 cc's of liquid. There's blood in here. There is plasma, essentially red, pink, yellow, all normal. All normal. You can see I've got the tube is full of yellow, and I'm like, well, I'm not peeing out of this thing, so why is it yellow? There's things that are still being filtered out of your body, and it's going to be through this tube, and there may be some blood in there. So red, your yellows are going to be normal, and there's not much maintenance to it because the tube's in there. You don't feel it. I don't feel the tube in there. I don't feel the spot, and they have this tape barrier that even if it pulls a little bit, you don't feel the pain of the drain tugging. Essentially every half a day, my wife, because she's helping me with it, she would unspin the top, she would pour this out in a container, she would make a log of it, and then just discard it. Now you have to make sure that there is pressure, or you have to deflate this and then close the cap, so that way it has a suction ability to bring anything in the tube in the bottle itself. And so the care of it was just unloading or emptying out the drain twice a day and monitoring it. The ones that I was told to be really concerned about is, first, if you see any white, anything that looks like pus, anything that looks like it's some sort of real tinted color, like a whitish color, or it has a distinct smell to it, that's when you've got the potential of an infection, and you've got to contact your doctor right away. Contact your doctor right away if there's any kind of white in there. Not white residue. Like, I will see some little portions of skin in here, or I don't know, tissue. That's not the concern. It's when you start having white come out, some sort of pus, or it has a distinct smell. That's a sign of infection. You got to see your doctor right away. So not much in the form of care. The worst thing in the world, probably even more than a lot of what you'll deal with the first week, is getting the tube out. The tube is so long, and I am dreading so much getting this out. The first one, I thought it was like a quick little whoop. Nope. It felt like I had a scab on my arm, and somebody was scratching the scab all the way off. And yes, it will put the hairs on the back of your neck up, but it's true. The drain pull is one of the worst. If you have pain medication, if you have anything that you can take to relax you or provide any kind of pain relief, please do it. Because it's just so bad. It's so bad. It's so bad. I have to emphasize, it's so bad. Would you do it again feeling how you feel right now? I think I answered that a little bit earlier. I'm only 10 days in, so that's where I think I'm going to really be happy I did this, but I don't see any. I only see the uncomfortable, the pain, the discomfort, the getting up, I'm in the middle of all that right now, so I haven't been able to really say yes so far to it. My apologies if I've missed any questions that have come through. I scrolled up earlier, and okay, so not sure if you answered, but how much did it cost to have your surgery? So this is where the surgery is depending on if you're paying out of pocket completely or if insurance. Insurance will cover anything that is a potential detriment to you. So if you now have rashes, if you have any skin complications because of your skin, take pictures. They're going to be able to use those with the insurance company that you speak with or whoever you're working with. If you're going to go through insurance, the more you're able to document the uncomfortable rashes, inconveniences, all that, it's going to really help the case. There is a portion, depending on how your insurance policy is covered, that typically 9 times out of 10, your insurance company will cover hip to hip. So from one hip to the other, they will cover that tummy tuck. Now beyond that, that's where, and I'm just turning on the vibrating recliner because it feels really good, especially with everything going on. But hip to hip is what's covered. Depending on the insurance company, the doctor, the relationship, additional may be covered. Hip to hip up the middle, liposuction 360. But for the most part, it's going to vary. Now, I had 3 quotes for my like everything, and essentially everything would roughly be about $80,000, $85,000. of the procedure. Now, depending on what your insurance company will cover, you can get it. And I did have a quote for $60,000, but that $60,000, I didn't feel comfortable with that doctor performing the procedure. So that may been a low ball estimate, but you're looking at 60 to 85,000 based on the experiences that I had. Now, your out-of-pocket is going to be different. Your out-of-pocket's going to change. My GoFundMe for both my abdominal area and my chest was $16,000. That was essentially the portion that I had done a GoFundMe for. Now, because I was able to get a lot of the portion of my midsection covered by my insurance company, the $89.30 that I raised was able to take care of my midsection. The remaining $7,070 essentially would be able to take care of my chest and kind of the underarm area, and that's what my GoFundMe currently is raising for, is for that remaining that. So if I just put it out there, but if you're able to share, you're able to donate towards the chest surgery. Essentially, I'm just waiting to raise those funds to get this portion done, but I do have the midsection already done. As you can see, I've been doing a lot more on YouTube. I'm trying to get kind of that YouTube partnership status to see if I can try to raise the funds that way. I recently wrote a book about my journey and hoping I can put funds towards that. So been doing all that I can to put myself in a position to get my chest done and just be done with skin surgery altogether with. So I got the drains question, which was good. Would you do it again? I answered that. Not sure I answered it. Okay, I answered that one. Are you happy you did it even with all? Would you do it over again? So I think that is a common question, and this is where I think I'm going to really enjoy. The fact that I have to wear clothes in a certain way because of the additional skin. And I'll share this picture again because I think it was very insightful on kind of what I was facing. So this was right before surgery. So you see where the line is from the belly button across? That's typically where my pants would be pulled up to. And so everything below that, I'm trying to tuck into pants or shorts. And you can tell oftentimes that I had a tire down there. There was a tire of skin. I think I'm going to be happy because there isn't going to be a tire. That's one thing that I'm excited about. I don't fully comprehend, and I still have that body dysmorphic view on what it's like to have a flat stomach. The fact that there's nothing in between me putting my hand up here and going all the way down to my pubis area, I've never experienced that before. So that's where it's like, whoa, that's new. I think I may feel a real happiness and not that additional bouncing from jump roping. Hey, Murray, that additional issue with running and all that, I don't think I'm going to experience that as much. And so I think there will be a benefit, or I think I will be happy about that. So as of right now, I think I'm going to be happy. I think that's the best way I can answer it because I'm only 10 days out, if that hopefully answers. Let me... I can't move myself. Hold on. There we go. I can move myself. I'm considering getting this. I'm just going to ask, have you been able to wipe yourself? Hey, this is a really good question. I was able to take care of myself. Now, when I recommended the portable urinal, that is absolutely clutch. Because the amount of effort and time that it takes to get up and go to the restroom sometimes is so much that you don't have enough time to get there and get yourself situated to go to the restroom. So get that urinal. And the one I got from Walmart, it was like $9. It's got a female attachment as well as a male. Honestly, for males, it's probably going to be easier because you can just urinate right in the capsule. They do have an attachment for females that I think may make it easier. But I would definitely get that. And then I didn't have an issue cleaning myself up, if I'll put that in the best way possible. I didn't have any issue with that, which I'm grateful for. A stool softener is going to be important to take, really, really important, because of all the medication that you're going to be on from all the pain relieving that you're trying to get done. because the pain relievers will cause constipation, get a stool softener. It's just going to be the better way to go to make sure that it all, because the last thing you want is, imagine being pent up or built up with all that you've got constipated in the midst of a tight situation with your midsection. All of a sudden now you're constipated and you can't get anything out. You're just putting more pressure on an area that just got newly stitched. So definitely invest in a stool softener, because it's just going to make easier for things to pass through. And I remember the first time I passed stool, I felt such a release and such a relief. It was almost like this weight was off my shoulders, because it had been about 3 or 4 days where there was just nothing, absolutely nothing. And when that stool finally came, it just made it a whole bunch easier. So let's see, blink twice if that was from yesterday's video. That was funny. Once you're healed, can you make an Amazon folder? So I have put together a loose skin Amazon storefront list. So if you go to the link in my bio and go to like my beacons, it shows my Amazon storefront. I have put together a storefront, and it's lists of things that you're likely going to need. And I'll constantly be updating that. I think I need to add like stool softeners, arnica, different stuff like that in those lists to kind of help round out everything that you're potentially going to need. But that is definitely something that I will put together and make sure to updates. Got some additional questions here that I'll answer. Are you going to postpone your chest surgery? So my chest surgery is essentially really up to my GoFundMe if I'm able to raise it. I talked to my doctor, and she said I'd have to wait at least 2 months or 8 weeks before they can consider doing a second surgery. But with how my doctor works, because this is more cosmetic and they've provided me a quote, their policy is that the funds would need to be available 1 month before the procedure. So say I've got the GoFundMe going on here now. I would have to have it, say if I was going to get the skin surgery right at 8 or 9 weeks after my first surgery, which was June 17th, we're looking at the first or second week of August. That means the first or second week of July, I would have to have all the funds available, and I don't think I'm going to be able to raise the GoFundMe by that time. So I'm really just going to be sitting out or waiting for the GoFundMe to get to the point where I can then call and say, hey, I've raised enough to do the chest, and then essentially schedule the chest. The chest is essentially the removal of the nipple and the removal of everything that is excess up here, the tightening of it, as well as what's underneath my armpit. She's talking about doing my arms, but I don't want to do my arms. I don't think I need it. There's a lot of muscle mass that I can put on in that area, so I'm not too concerned about my arms, but really underneath my chest, my armpit area and my chest, and then be getting a 3D tattoo of a nipple. And so that's essentially what the next, after this is recovered and healed, I would like to get my skin surgery for my chest done and get it over with. So I do have a newly created GoFundMe for just my chest. My first one, I was able to raise about 58% of my goal. And so whatever that remaining was, I'm putting in the new GoFundMe that's just for my chest. I'm about to have a appendectomy surgery, stomach surgery, removal surgery. It's hip to hip and all the way up past my chest. Wow, I'm nervous, but watching your healing has helped. Thank you for sharing. Of course, and I will be putting up some more pictures of how this is healing. What I've read is between the second and fourth week is when things are really bound, especially if your surgeon stitches things and glues things together. Between the second and fourth week is when things really feel bound. I will tell you, right now, day 10, I feel lightning better. Just so much better from a week ago, as far as things adhering. It feels like things are attached, but it still feels a little, it's like you hurt yourself, you get a scab, and man, that scab is pretty much good and almost healed. But you know that if you peel the scab off, it's still going to bleed. That's where I'm at. A portion of I can feel attached and healed, but it's still very sensitive. The big thing for me is my binder. You keep your binder on. I've just always kept it on, and I've kept the gauze over it. It gives that feeling of security for me. Like imagine a hangnail and putting a Band-Aid over the hangnail because every single time you rub it, it feels and it bothers. Well, I put a Band-Aid over it, you don't feel it, like you're just operating normally because now there's nothing rubbing against it. That binder that you wear, bandages that I wear over my incisions, they have helped tremendously. Taking arnica has been really helpful, and it will heal. The binder helps a lot. So make sure, I have a secondary binder. They'll give you one at the hospital, but I'm wearing the secondary binder that was a little bit wider, and it just feels more secure. I feel more together with this binder, and I'm going to probably wear it for 4 weeks and beyond. So I think that's really, really going to be helpful. Let me see. Do you feel people who get gastric bypass get the help required to work through mental, emotional causes? No, not anything whatsoever. I think the weight loss surgery folks are given a quick appointment with the therapist to sign off on the surgery, and that's the end of the extent of the help. I think immediately, hey, weight loss surgery, hand in hand, setting up monthly appointments with a therapist, because it's all mental. You can lose the weight with gastric bypass, gastric sleeve, whatever the case is, and the weight can absolutely come back. 84% of the folks that get weight loss surgery end up gaining the weight back. 84%. The reason is it has less to do with the food, the diet, the exercise, the program, anything like that. It all has to do with the mental repositioning that you're going to have to do so that you can lose it and keep it off for the rest of your life. That's huge. That's really, really, really huge. Arnica. So arnica is, this is a homeopathic medicine, and this is something I got suggested prior to having surgery. A lot of folks told me about it, swear by it. It's plant-based, but it really helps with bruising, healing, and any kind of surgery incision areas. It really helps with the healing and bruising and of wound care. So I got it off Amazon and Vitamin Shop, and I think it's moringa. It's an enzyme in pineapples. It really helps with healing, injuries, bruising. It's just an additional thing that isn't going to mess with anything. Like, it's not a over-the-counter medicine or anything. It's something that's plant-based and may potentially provide additional nutrients that I can heal better. So that's really, really important. Can you please pin your GoFundMe page? I don't see it. So if you go to the homepage or my link in my bio, if you click the link, it'll actually give you 4 different options, and one of them is actually for my GoFundMe. It's also on my Beacons page. So hopefully it's there. If not, shoot me a DM. I'd be happy. Thank you for even considering donating towards the chest surgery. I'm looking forward to finally getting that done and kind of showing off the whole, this is where I was and this is where I am now. My wife did have the bypass as well. So let me show you kind of what the side-by-side is. Now, I will go back to some of the questions if I see some, but we'll kind of go to what, let me see. All right, so I'm going to share, let me see. So this was post-surgery. So let me preface this, and I'll give a 10-second sign-off. I'm going to show you directly after surgery what it looked like, what the incision looked like. So if you're sensitive to that, I would step away from it now. And 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, I'm showing you. All right, so this is what they did. They went hip to hip and up the middle. Now, the big thing, and I've shared this on stories, and I may be repeating some, but I think for those who haven't heard, you see these stretch marks, right? I wish it was like a little pointer. You see right here, see the stretch marks that are going side to side? Those were going up and down right between my nipple and my armpit area. They were going this way. She shifted them to where they're now going this way. And a lot of my top incisions here are all those stretch marks. It's kind of weird seeing stretch marks as like what's being adhered together. But you can see that's where my new belly button is. And let me just tell you, I thought she went too high. And I freaked out. I thought she went too high. I freaked out because I was like, what? Like, why is it all the way up there? And I'm freaking out, to be honest with you. I'm like, what's it doing all the way up there? Let me see if I can show you picture. There we go. There we go. Okay, so I've shared this one before. So I'm freaking out because I'm thinking it's too high. Like, what in the world? But where's the belly button? So the whites, where the picture is now, where I am now, hi, I'm the belly button. That's where the belly button is. That's where it's hard for me from a body dysmorphic point of view, how I can really understand where I'm supposed to be this whole time. I've always struggled with my weight. I was born 11 pounds. I've always been big. I've always had a bigger stomach that is hang down. Hey, Sean. And so because I've always had a stomach that's hang down, I've always had that, well, this is where my belly button is. It's low. Where that white in the middle is, that's where my true belly button is. And so where she made the incision hip to hip, to me, seems very high. But truly, the belly button is where the belly button is supposed to be. She was just removing skin and aligning where the belly button is already and aligning my skin to where it should be. And so that's... now, this does show the rash that I unfortunately got. There was a chemical that they use to clean you off at the end. I guess it was something that I had on it before, but it was a T inhibitor to where it doesn't really react or give an allergic reaction the first time you come in contact with it, but the second time you do, it gives an allergic reaction. So if you see rashes, that's not common. That's just something that I encountered or something that I experienced because they use something as like a Chloranax or something like that I am allergic to, and they had to update my medical records and chart that I am allergic to that. So that is something that I now know that I'm allergic to, and something will probably play into factor the next time I have surgery to get my chest done. So you can see a little bit here. This is me trying to like lay as flat as possible so you don't see much loose skin, but see that right there on the side underneath the armpit and over on the other side, that's essentially where she's going to finish up with the chest surgery, is to really get that finished and done. How do you as a couple help support a healthy lifestyle and not fall into unhealthy patterns together? Honestly, we can be our greatest assets and our greatest setbacks, because one of us will be like, okay, we're getting consistent, we're getting on a grind, like, oh, hey, do you want to have this? And it would kind of pull that person away. We both really try to come together and communicate on what we're trying to do, and we try to do what we can to support each other. If one of us is like, I really want to focus on dropping some weight, or I really want to focus on getting as lean as possible. That's what I was saying. I want to get as lean as possible for the surgery. That communication really helps. And having that conversation of not just like, man, I just want to lose weight. No, but it's like, I need your help. Like, I'm not saying you can't have anything in the house and you can't eat anything or there can't be any, but can you help me focus on getting to my goal? Or, like for instance, I know that high protein is the way to go. So when my wife and I want to go out, okay, we want to focus on high protein. Instead of getting birria tacos, is a good example, let's get a pound of meat and let's mix that in, take that home and put that in with some asparagus, Brussels sprouts. And so finding a way that we can support each other by communicating how we're feeling. And I think if we're both honest with each other, that has really, really helped our journey, especially going forward. Did your hip-to-hip incision go all the way around? I can't remember. It did not. So it stops. So where, as far as you can see it, is where it is. It did not go all the way 360. She stopped essentially right there and essentially brought it in like a curtain. Once you heal, it's going to look amazing. It looks so good. I am looking forward to that. What's tripping me out is, and I think about this all the time, because this area down here was all over there, I think my mind's freaking out a little bit. Like, hey, we're supposed to be feeling this over here. How come we're feeling this over here? I mean, I've got a portion of my skin that is gone, never to be come back, and then I've got skin that was all the way over here that has come together. So I'm looking forward to what it's going to look like, and I'll keep sharing updates on how the skin looks and how it heals and how it updates. But so far, it is a lot more than I expected. 12 pounds of skin. I mean, let alone just the skin, I'm lighter. I'm lighter on my feet just because of the skin. But, I think the chest will probably be an additional 2 pounds. So I could lose a total of 14 pounds of skin based on what I had before. So that's what's pretty wild and what I'm looking forward to. Let me go back real quick. Is this current or has your wound healed? So this is about 2 days ago. And so I currently still have, you could probably see the wrap a little bit, but I still have the wrap. And you can probably see a little bit on the incisions too far down here, but this is about 2 or 3 days ago. I'm on day 10, and this was about day 7. So I'm currently, and honestly, a lot of it looks like this still. There's just little bits that look a little bit more healed and a little bit better from this whole thing. So this is about 3 days ago. So still very much inflamed, a lot of swelling, especially in my hip where my drain. Ooh. Clearing your throat, coughing is a task. I will tell you that one thing. Hey, here's a tip. Be mindful of your... It feels weird. Coughing is the absolute worst. Have a pillow if you need to cough, because that helps a lot. Painful, yes. Pain medication is very important. And this is one thing I'll before I go back to the questions to see if there's any more, get your pain medication. Ask the surgeon beforehand, what medication are you going to be prescribing me afterwards? And what is the optimal time to take each one of them based on the time that I'm going to get out of surgery and the days after that. If you get that down, have a journal, have a log of what's all going on, you're going to set yourself up. I did not put myself on the right pain rotation, so I went hours and hours between day 2 and day 5 where I had no medication for the pain, and it was dreadful. So definitely figure out your pain medication rotation. That will help out tremendously. Did it hurt when you cough or anything like that? What you just did, clearing your throat. Now it doesn't hurt. The first time I coughed, that was, gosh, I'm trying to find a good example of it. I mean, because of this being an incision and a wound, I felt like I expanded it, and it was like, okay. It's like I felt like it mentally like opened or stretched the wound, and so that's where it hurt the first couple of days. Now it's almost like this weird kind of pinching, a little bit of a sharp pinching. That's where it feels now. It's almost like a duller, sharp pain than it was day 3, day 4, day 5. It's almost like a strong pinching is what I would say. Someone's pinching, like doing this, twisting it. It feels like that. It's probably the best way I can. Let me go back to the questions real quick and see if there was any ones that I didn't answer before we end the live. I think this was a good session. If you knew today how the last 9 days would have been, would you have made the same choice? Ooh. Ask me that in 3 weeks. Well, let's do that. Let me get better. Let me get to 3 or 4 weeks, and I think I'll answer that. Because I don't know if I can answer that in day 10, because it's been rough. Was asking because when a lady has a C-section, it hurts to cough and sneeze, laugh, or anything once they stitch you back together. My wife had a C-section after the birth of our first little girl, and that was very, very tough. And I mean, let alone, you've just got done carrying a child, a life, for 9 months, and all the pains and struggles of giving birth, and then all of a sudden now you have a huge incision where the C-section was. My wife was completely right. I have definite pain, but relative compared to what you moms out there have to go through. It's just like I go have the surgery and then have pain. moms out there, like carrying a baby for 9 months and everything that goes with it. Baby number 2 for my wife was a lot more difficult than baby number 1. And so I can definitely understand going through the grind that is the ups and downs, because baby number 1 for us felt so much easier than baby number 2. Baby number 1, our daughter was like, oh yeah, we can do this parenting thing. And our son very much humbled us very quick, said, maybe we don't know this parent thing. Yeah, maybe we're, and so we became rookies very quickly with our son. So yeah, then when you have to wake up every 2 hours while healing and breastfeed and take care of the baby, that's it right there. Let's see. Will your wife need skin removal as well? Or is she not in need? So she'll probably need skin removal just as well, because she had the bypass and how much she lost as well. She's probably going to have loose skin. And I told her, and honestly, it is something I mentioned to her. I said, it's how this has typically happened is that I've gone through the bypass, lost a bunch of weight. Then you went through the bypass, lost a bunch of weight. And so now at this point, I've got the skin surgery. So next up, so as much as she took care of me, now I'm going to in turn take care of her. And so how that pans out and the timing and all that good stuff, we will see. But we'll definitely have to document her journey as well, and kind of see what I've learned from my journey that could potentially help her. My wife is still... My wife is exclusively breastfeeding our son of 15 months. He's never taken a pacifier. He's never taken a bottle. He's exclusively breastfed. And he is not a good sleeper. He has not, in his 15 months of life, slept through the night. So think someone who is exclusively breastfed and has not slept through the night. We are still going through the grind that is baby number 2. And so my wife mentioned I just need to lose the baby weight. We everything happens in the season that it needs to happen, and we are still working out the grind that is baby number 2. And so everything's going to happen in the time that it needs to happen. So how long was your recovery time from the bypass? So from the bypass surgery, at this point now I'm thinking, because it was back in 2016, it's almost 9 years ago now. I think that the first week, I think I could have gone back to work after the first week. I think I took 2 weeks off, and that was a good safe bet. So if you're thinking about the weight loss surgery, give yourself 2 weeks for sure. Because it's a lot, I don't want to minimize that surgery, but it's a lot easier to recover from. Because it is 5 to 6 incisions, you're going to have to give yourself time to recover from. But I think compared to skin surgery, it's definitely a lot less invasive than a skin surgery, tummy tuck, hip to hip, up the middle, all that good stuff. So I think we have answered all the questions that came through. I think this was a really good live. Again, I'm going to save this and put this up on my profile to watch later. Let me see if I can remove the asset. I can. Hello. Full screen. But thank you for joining this live. Thanks for popping in. Thanks for the great questions. I'm going to put this up and save it again. And I'm also going to download this video and put it up on YouTube. That way, if you have any additional questions, and I just really appreciate you joining. I've been following you, but this is my first time ever being on your live. Oh, awesome. Well, thank you for joining. I actually really enjoyed doing lives. I was doing more about a year ago just to kind of connect with folks that I see here on Instagram. So that's one valuable thing I like about these, is because I get to actually interact with folks that I see and talk with. So very nice to meet you. Thanks for joining on live. Great questions. My question to you is how long it took you to get to where you are on your journey. So from the very beginning in 2016, it took about 2.5 years to lose 300 pounds. And that's actually the amount of time I would say it's going to take everybody, regardless of how much you have to lose. Because rather than putting a physical number on how much you have to lose, it's really about building habits and rituals and tendencies that you're going to stick with long term. It's not just about losing weight, but it's about keeping it off long term. And building those habits takes about 2.5 years. The best way that you can probably put it in a creative way is every day on the journey is 0.1%. And for you to get to the point where you're going to feel comfortable that you've lost the weight and you've been able to keep it off, and feel that you can rely upon keeping it off, is when you get to 100%. So one day is 0.1%, 0.2, 0.3, then you get to 1%. So you could be 6 months into your journey and still only be at like 22%. You're not going to think that you've crossed the finish line at 22%. That's where you really set yourself up for success, because how many of us go on a journey or on a weight loss and do it for 6 months? And then it fizzles out, and then you just go back to how you were doing things before. Old habits, old tendencies, old coping mechanisms, old addictions. And then you end up just gaining the weight back, and it becomes that yo-yo diet where you lose it, gain it, lose it, gain it, lose it. You got to give yourself 2.5 years. And if you go 0.1% all the way up to 100%, that's roughly about 2.5 years. And so take that approach to it. Make a big old long yardstick of 100% and put the 0.1s all the way through. And every single day that you're on a journey, put a little check mark on it. And over the span of 2.5 years, you'll lose the weight however much you want to lose, whether it's 20 pounds, 50 pounds, 100, 300 pounds. But you'll also feel at 2.5 years of you being consistent and not taking your foot off the gas and not getting comfortable and lackadaisical with your goals, that you're going to feel that you've stuck now to a habit and ritual that you're going to be able to hold on to long term. And you're going to be able to do it for the rest of your life. So treat it like that, and I think that's going to be really, really helpful. If you're interested, you should check out his podcast. See this Real MVP. I do have a podcast, and it talks a lot about what I talk about and share here. The link is in my bio. It's got about 270, about 15-minute episodes, and it talks about the whole journey, if it can somehow help. So, sorry for the screeching. I won't let him play with the knife. Okay, I gotta go. Thank you all for joining the live. I will save this, and I'll talk to you all soon. Take care.